G'day everyone, this is Health Highlights. Simon Ashley here, just working on the muscles I don't have. Health Highlights is a show about health professionals and the people and the stories behind the names that we hear about but we seldom get to meet. And today we are here at Hunter Rehab. Now you may not realise this, but 50% of Australians, that's right, 50% of Australians actually have a chronic disease, whether that be arthritis, cardiovascular disease, COPD. It is a plague in our community, chronic disease. So today we're here at Hunter Rehab with Ryan McCaffrey. How are you, Ryan?
I'm good, thanks Simon, thanks for having me.
Thanks for coming on board. So you're an EP and exercise is really taking off around the world and particularly here in Australia. Can you explain what exercise physiologists are?
Yeah, so an exercise physiologist is an allied health professional where you go to university for 4 years, same as the other allied health professionals. We specialise in prescribing exercises for people with chronic conditions and chronic injuries as well. So when it comes to prescribing exercises for an individual with these diseases or illnesses, we're the most qualified professional to be prescribing those exercises basically.
And look, a lot of people ask me this because being a manual therapist myself, what's the difference between PT, a personal trainer, say a physio or osteopath or someone who's a physical therapist, and yourself? Like, how do you differentiate between the three?
Yeah, so first of all, a personal trainer, they basically specialise in exercising with healthy populations. So if you don't have any type of pathology, no illness, no chronic condition, personal trainer is the best person for you to reach those physical goals you want to achieve. So when it comes to that, that's what a personal trainer does. When it comes to physio and osteo, we like to say that they work really, really well in the acute side of things. So when there's an acute muscle injury or any type of strain or any type of injury like that, that's where they really specialise in and do really good jobs. When it comes to more chronic and long-standing niggling issues, and the issue is lack of strength or deconditioning, then that's where we step in as exercise physiologists. So we all work together, but that's just sort of how we differentiate between the two.
That's great. So if I'm a client and I've got a pain in my body, so you've got the GP, you've got the manual therapist, you got yourself, what is the pathway for them to maybe come to you? Can they just come straight to you? Do they go through the GP? Do they need to go through the physio first? These are the questions we often get asked. Would be awesome to know the answer to.
Yeah, that's a great question, Simon. There's several pathways is the answer. So the first pathway would possibly be going to see your GP. They're going to have the best understanding of where your injury or illness is at and who's going to be the best professional to prescribe you to straight from there. If you have a pretty good inkling that it is just an acute muscle strain straight away, you should definitely just go straight to the physio or the osteo, get them to have a look straight away and progress from there. If we're as an exercise physiologist, we do all our rehab is exercise based, it's not hands-on or anything like that. So if you roll your ankle and you've got swelling in your ankle and you come here, there's not much we can do. That's where the physio and more that acute phase is going to help. So when it's a bit more, when it's a few weeks down the track, that's when you come see an exercise physiologist, or if there's a niggling injury, that's when you come see an exercise physiologist.
So Ryan, how long have you been doing this?
I've been doing this for about 6 years now.
And so why EP? Why did you get into this whole profession? Is it just a passion of yours, or did you just see the need, or?
I think it all comes down to the same as all other healthcare professionals. I just absolutely love to help people, and I have a passion for exercise. I've been exercising and playing sport my whole life, and then with that, I sort of decided to saw the degree of exercise and sports science. I said, oh, that's excellent, something I want to do. And going into that, still didn't really know what I wanted to do from there. Sort of followed that path and then decided to do a master's degree in exercise physiology, just as I learned more and more as I progressed about the importance of exercise and and how magic it is. Basically, it's the most powerful drug out there. It's absolutely amazing exercise, and I realise Australia needs to move more, and I need to help Australians move more. So that's what I'm passionate about.
So tell us about that. So you found the magic in exercise. So what were some of the things that you studied or that you see that exercise can really help with the community?
Yeah, well, when it comes to chronic conditions, if you go to a GP with a problem, basically exercise can fix, can improve that problem. Like, it doesn't really matter what problem it is. So it's widespread, all the way from cancer to heart disease to lung disease, and now all the widespread information on mental health. It's absolutely booming at the moment, and they're showing that exercise not only is beneficial, but it probably is the best treatment for a lot of these conditions. So it doesn't really matter what you have. If you're prescribing exercise and getting into an exercise routine, it's going to be so beneficial for you. It's just amazing.
So if I'm an injured, say, worker, for example, that comes to see you, so you're going to obviously give me an exercise program. Is that how it works, or how would a session look for coming to see you if I was injured?
Yeah, so with injured workers, we've got an excellent private gym facility here. So it's what we do first is find out what the specific roles and duties of their actual job entails, and we try to replicate that as much as possible in this gym scenario. So, for example, this morning we had a process worker who's putting turkeys and chickens onto hooks, and he suffered a neck injury. And basically, we need to build his confidence in that duty, so he can get back to work. So we replicate that role in here and do very specific exercise programs for them that basically reflects their job. They build the confidence in here. They're happy to go back to their pre-injury duties, and that's how we do it. We take it away from the clinical environment where they're sometimes in an office working with a TheraBand and things like that, and put them into this environment, and it just it helps them progress a little bit more in the rehab process when we sort of step away from that clinical side of things. So that's what we do with the injured workers.
Great. And so you said that there's a multifactorial range of things that you look at, and one of the things that I know that you've won an award for and got some money through the Honey New England, is that right? Is for cystic fibrosis and support of people who have cystic fibrosis. So can you explain what you're doing there? Because I think that's wonderful for people with that condition.
Yeah, so it's a passion that I do have is working with cystic fibrosis sufferers. I spent 2 years in London working at Great Ormond Street Children's Hospital, which is the largest children's hospital in Europe. And I worked on the cystic fibrosis ward there, actually prescribing exercise to the children there. So exercise is the number one treatment for children with cystic fibrosis, which is a lung disease. So when I returned to Newcastle, I decided to figure out how I can follow that up and try and get kids with cystic fibrosis into exercise programs. Unfortunately, there wasn't any program at that stage, so we put in for a grant with the Primary Health Network. And we're lucky enough to receive a $40,000 grant earlier this year, which allowed us to basically get around 20 to 25 cystic fibrosis teenagers to get them into an exercise program for a bit over 6 months. We're doing a lot of testing and measuring at the moment, and the results have just been absolutely amazing. So
can you share some of those results? Is that possible?
Yeah. So the main thing they are testing is VO2 max. It's basically the gold standard of your fitness. In cystic fibrosis, the research shows the fitter you are, the longer you live. It's very plain and simple in cystic fibrosis. So the higher your VO2 max is, the longer you live. Simple as that. So they're doing VO2 max tests at the hospital before they come here. They're doing high intensity interval training here, and then at 6 months they're going back there and doing another VO2 max test, and also lung function as well. Lung function's increasing, VO2 max is increasing as well. The other side of it is the mental health as well. So a lot of them are building confidence, and cystic fibrosis sufferers are twice as likely to suffer from depression and anxiety. So the exercise side of things is definitely helping that, and the parents as well. They're responding really well in terms of all the benefits involved. So it's an absolutely amazing program that I love.
Good on you. That's wonderful to hear. And to help a group like that who obviously need that support is just wonderful. So good on you.
Yeah.
So finally, last question. It is 2018, and we all want to be fit. What is your top tips about staying fit, being fit, and keeping fit in 2018?
Yeah. So it's the same thing that when people come in here, we do the first thing we do with them, the most important thing is goals. And we do a little exercise called the 5 whys. So basically, a lot of people have goals, but we dig a little bit deeper. So basically, we get someone to state their goal, and then we write why 5 times underneath that, and we dig very deep to get to the bottom of that goal. So if someone wants to lose 5 kilos by June, that's not good enough for us. That's not specific enough. There's no emotion attached to it. So we ask, why do you want to lose 5 kilos? Oh, so I feel better. Why do I want to feel better? Oh, so I can run around with my children. We go dig deep. Once you have a goal that's attached to emotion, you're much higher to succeed. So that's what we try, and everyone must figure out what their why is. So you don't just want to get fit, there's always a reason behind it. Once you have that attached goal, write it down, and then plan your steps towards that. Even come in and see an exercise physiologist, keeps you accountable, puts a plan together for you. Someone to keep you accountable and consistent. But the number one thing is that goal that's attached to emotion.
Yeah, that's really great. That's great advice, because when you've got that connection, that emotional connection, there's something about that that drives you, doesn't it?
Yeah, exactly.
Wonderful, Ryan. Absolute pleasure to be here in your facility. Thank you for your time, and thank you everyone for tuning in. If you want to find out more about Ryan and the incredible work he's doing here at Hunter Rehab, all his details will be on the screen for you right now. And if you want to leave a comment or ask any questions around cystic fibrosis or anything else about exercise, just leave a comment on our Facebook page, and I'm sure that Ryan will be more than happy to get back to us. Look, have a fantastic week. We'll be here the same time, 12:30 next Wednesday. So tune in. Thanks for joining us. Remember, healing is a gift, health a responsibility. See you next week.